Good morning. I'd like to call the June 10th Human Services Committee to order and to welcome you all here. I'm looking for approval of the agenda. Of approval by Commissioner Rice, support by Commissioner Leitner. All in favor?
Aye.
Public comments. Is there any public that would like to make a comment at this time? Public comment? All right, thank you. Next, moving on to committee items, we have the minutes of the May 13th Human Services Committee meeting.
Move to approve the minutes of the May 13th meeting. Support.
A motion made by Commissioner Plachek, supported by Commissioner Rice, to accept the minutes. All in favor?
Aye.
Opposed? Next up, we have Medical Examiner's Office, their biannual report.
Good morning. I'll be reporting for Dr. Mano because he had a family emergency this morning, so he wasn't able to be here and sends his regrets.
Would you please state your name?
I'm sorry, Jill Glare. We have our 2012 numbers. We did 329 cases and 140 autopsies. So far this year, we've logged in 162 cases and are at 59 autopsies. For 2013 so far, our breakdown is in accidental deaths we have 17, homicides there's 2, suicides we had 8, and undeterminable deaths 11. Those were numbers as of Friday's date. The health department had a water contamination exercise, which I attended. So we're continuing to attend things that have to do with emergency management. Dr. Mano serves on District 1's board and goes to those meetings as well. So anyway, and as far as the 2012 budget, we did come on, the revenue came in at 96%, expenses at 98%, so the net was 99.26%. This year's budget so far, our revenue is at 38.26 and expenses at 37.31. And that's pretty much it.
Thank you. What questions or concerns might we have for our presenter, commissioners? All right, thank you for the report.
All right, thank you.
Next, we have the Department on Aging.
Good morning.
Good morning.
And you have my report. The first part is about the federal sequester, that we received no word that something might be cut as far as our federal funding, but hadn't heard for sure how much. And the Area Agency on Aging has made arrangements that some of their available funding will replace the federal sequester cuts that Department on Aging grants would normally experience for the current grant year. It's about $30,000. The State Office on Aging, so it goes from the Federal Administration on Aging to the Michigan Office of Services to the Aging and then the Area Agencies on Aging. And at the federal level, they don't even know yet what cuts might be happening as of October 1st, which is the beginning of the next grant year. So, but right now, thankfully, the Area Agency on Aging is able to replace that large sum of money. Provider appreciation. Last year we began having a provider appreciation as part of our annual senior festival, and this year we recognized 2 employees at the Jackson District Library. Joyce Betts leads computer classes at 2 different senior sites, and then Marcia Young coordinates the program that delivers library materials to people who are homebound. So we've had a lot of contact with those 2 employees to provide in our joint efforts to provide services to older adults. So we just wanted to let them know we appreciate it. At the Senior Festival, our attendance was lower this year than expected. And what happened, in my opinion, the tornadoes in Oklahoma happened 2 days before our festival, and the day of the festival, there were dark clouds in the horizon, and I think people were in early warnings of severe weather, and I think people were just a little skittish about going out into a mall for a senior festival. So that's my take on why the attendance was low, but it was still a good amount of exhibitors, 54. We think about 225 attended. Normally we have 400, 450, and then 183 ate a congregate lunch. Our chore program, that's coordinated by Leslie Krantz, and she and I have been in contact with Habitat for Humanity because Habitat volunteers are well-versed in building codes and have been trained in how to install different items in a home. And our chore program, it's funded with a grant, installs grab bars. So we're trying to coordinate to see if when a couple Habitat volunteers aren't actively on a job at a house, if they would have some time to install grab bars for us, and instead of our paying a casual employee. So we're trying to see how we could coordinate that. Probably in July it'll start. Excuse me. And last month I reported that the Friends of Jackson Seniors, they're a nonprofit organization that supports programs for older adults. They were approached by the Center for Family Health asking, the Center for Family Health asked if Friends of Jackson Seniors would apply to Weatherwax for a senior dental grant, and that funding was received. Friends of Jackson Seniors received the Weatherwax Foundation funds May 22nd. So Leslie Krantz, she wears a lot of hats. This is another one. She's coordinating our unmet needs program. So people can contact our office if it's someone with a dental need that they don't have the financial resources or insurance to pay for the cost for the dental need that they have. And it's not cosmetic. It's things that affect their ability to chew and mouth discomfort, needs like that. So please have people contact us. And I wanted to raise awareness. There's a campaign called No Excuse for Elder Abuse, and I gave some information in my packet monthly report, and I included a copy of a brochure that brings to light financial scams, and just to be aware of neighbors, friends that may be in those situations, and encourage them to report any financial abuse. A lot of times it happens from family members. I mean, we get scams, phone calls, they get a lot of phone calls, but the brochure highlights that it's not okay for a granddaughter to take a credit card and charge her car repair and not pay it back, that type of thing. So again, just to raise awareness when you talk with people. And Danielle Paquette, our in-home services coordinator, is working with Elder Law of Michigan and Department of Human Services and other community organizations on having a training this August on elder abuse, how it's detected, how to report it, and how as organizations in the community we can work better together towards lowering the incidence of elder abuse or elder mistreatment. So, and I have a thank you from someone who talked with Lisa Rudolph. She's our part-time caregiver information and assistance specialist. So we get calls a lot of times from adult children saying, you know, my parent, they need services, they need help, what's available? What are my options? And Lisa is an encyclopedia of what resources are available, and she talks with a lot of adult children. And we give out a card. Some come into our office and some, this is over the phone, but when they come to the office, we give them a card if they would please fill it out and either mail it in or drop it off in our comment box on their way out. And this person said, Lisa was prompt in returning my call, extremely helpful. This service is a gift for us adult children navigating new waters, wanting to give best of care to our parents. Thank you. So, just want to pass that along.
Thank you, Marcy.
Okay.
Commissioners, what concerns or questions might you have for Marcy? Commissioner Rice?
A comment, Marcy. This is the third year I've been to the Senior Festival. And I know we talked and the numbers were down, but for me anyway, it was still an excellent event. It seemed to me that the seniors that were there certainly enjoyed themselves. And the congregate meal was very good. I had one, okay, two. But anyway, and the band was very good too. So, and I'll try again next year, and you know what I'm talking about. So,
Okay.
thank you.
Well, thank you.
Thank you. Anyone else? All right, thank you, Marcy. Up next on the agenda, we have Mary Beth from Lifeways.
Good morning. How is everybody this morning? Good. I'm here to give my update, monthly update in regards to Lifeways and things that are happening at Lifeways, including local funding. Just wanted to discuss the fact that some of our strategies related to the facilities and support for with Lifeways on regards to maintenance and facilities. We're in the process right now of negotiating that rate and fee schedule and what it is that the county will be supporting us on and what we will continue to provide that we need to maintain in-house. So we're in those negotiations. We're also in the process of negotiating with Hillsdale County regarding their group homes for support. They already do provide the maintenance and facility cleaning types of stuff for the Hillsdale building already, for our building in Hillsdale, but this is a negotiation for extending it to the group homes that we have in Hillsdale County to help with the offset related to local funding. The other thing that we're continuing to do, and hopefully within the next week or so, I will actually have correspondence, written legal opinion back, is in regards to a strategy that we were wanting to implement related to the provider contracts, and the fact that the current contract with the department does allow for providers to also contribute to the local match, and how to set up the contracts to allow us to have that arrangement in a way that does not violate any anti-kickback statute. So I am hopeful that we will have that soon, at least by the time that we meet next month. Tenant leases, that's another area in which we continue to look at when the leases are up due, increasing the rates as we're allowable to be able to generate some additional local funding. We are also in the process, due to the vacant space, two things. One, looking at another short-term tenant for during the holiday season, the Halloween time, like we did last year, to generate some funds for that portion of the building that currently is vacant. And we are in the discussions with CBRE in regards to a long-term tenant as well. The other thing is that we do have, it's not a lot, but we do have U of M who's interested in renting 2 offices to do a research study, so we will be generating a little bit of revenue related to the use of that space as well. The other thing is that we have initiated conversations with JTA in regards to some of the services they provide in relation to offset for local funding. And then we do have another sale this weekend related to everything under the sun. We still had some office furniture that we did not sell at the last sale, and in order to be able to clean out the rest of that space in preparation for the potential tenant, short-term tenant, and the long-term tenant, we are having another one this weekend. Where staff are making some donations, and providers as well as staff internally getting on board and doing things to help generate local revenue for that event. The other thing that I would like to provide an update is related to the Medicaid expansion. As you know, the budget did not include Medicaid expansion this year. There still is advocacy on behalf of our association and many of us CMHP directors in regards to Medicaid expansion, and the ability for that to help with the local funding is significant, as well as being able to meet the needs and offset our costs associated with our general fund dollars because of individuals coming in who do not, who are uninsured, meet eligibility, but do not meet eligibility for Medicaid. Medicaid expansion, as we see it and as our association supports it, is important for those in Jackson and Hillsdale County, so we will continue to advocate for that. in the middle of May, I met with both Senator Caswell and Senator Richardville, who came down to Lifeways and did a tour with them and had them spend the afternoon with our Clubhouse program to be able to show them the benefits of what it is that we do at Lifeways for the people of Hillsdale and Jackson County, and to really advocate on behalf of the need for them to be aware of the importance of Medicaid expansion. So that did occur. And then an update related to the regionalization. As you know, we've been in the process of having that occur, and the regional entity needs to be up and running by July 1st as part of the state's plan. The new region is going to be called the Mid-State Health Network, and again, it's going to be made up of 12 CMHPs. This new regional entity will not be a part of any of the existing CMHs or PIHPs. As you know, Lifeways is a current PIHP, and there are other 4 PIHPs in our region. Those functions related to the PIHP starting January 1st will be provided through the new regional entity. Right now, our governance structure for that regional entity is made up of representation of each of the CMHs, 2 board member appointments, and one of those appointments needing to be a current consumer, so that we can be sure that the voice of those that we serve across the region is heard. That board will have their first initial meeting at the very end of June. At our next board meeting, our board will be appointing and approving those appointments, which will occur in 2 weeks. So just to let you know that. And I think that's it at this point in time.
Thank you, Mary Beth. Commissioners, what comments or questions, concerns might you have for Mary Beth? Commissioner Placzek?
Hi, if you continue to the lease that you have now, and you get the long-term lease that you're talking about, could you let me know how many square feet you have available for rent after that?
I could get that information and provide it for you. I don't know. There's still some vacant space in little portions of the building where there's some offices, but that is the majority of our vacant space, is that front where Hollywood Video used to be. That's the majority. Yes. Yes.
One's private side and one's
Yeah.
not-for-profit side.
Yeah.
She's talking
I can.
about the private side. No, I don't know.
Okay, I can explain that. Oh, I can explain that. The building, when we purchased the building, was split into 2 parcels. One parcel is a non-for-profit section, and that's a majority of where Lifeways provides services, because they are Medicaid reimbursable services that we provide, as well as a couple of our nonprofits that lease space from us. The other portion of the building is considered for-profit, and that's the portion of the building where currently we have the majority of the vacant space.
Okay. All right. Thank you. If you could give me those numbers, though, I'd appreciate it. What I have is somebody that's interested in moving, and they're a nonprofit. So, yeah.
They may have to be on the nonprofit
Right.
Right,
side, for-profit side.
right. I can get those numbers to you.
Thanks.
Commissioner Rice?
Hey, Mary Beth.
Hello?
This, in regards to Medicaid expansion, I certainly understand your advocacy of it, and certainly that mental health is advocating for it. I have been on record as saying I do not believe it's going to happen in its current form. Once we find out what it is, I guess we go from there. But we also know that there were, as you also put in your report, there's $114 million that has been provided to mental health in the 2014 state budget, some of which I suspect Lifeways will receive some of that funding, correct?
A small portion. Some of those are earmarked specifically towards the autism benefit that I've shared with you. Some of it is related to pilots for the health homes that they have in certain counties in the state of Michigan. And then there's also some specific to jail diversion and youth services. But I don't have the exact number that would be for Lifeways at this point in time. But when you look at the other projects that some of those dollars are earmarked for, it's not probably going to be that significant.
Okay, You had mentioned that Medicaid expansion could help with the local match, correct?
That's correct.
So, in regards to this 114 million, you just give a breakdown. Can any of that 114 million help with the local match?
No, because those are Medicaid dollars, which have very strict guidelines about how you can use Medicaid dollars. You can't use those dollars to, towards your local match obligations. To try to explain why, when I indicated that if Medicaid expansion was to occur, that would be helpful for the community mental health in the state of Michigan, is that by Medicaid expansion occurring, many of the individuals currently who we serve through our state general fund dollars would then be eligible for Medicaid. And by then being eligible for Medicaid, the state then frees up general fund dollars to the CMHs. What we're proposing, and we have submitted to the department as an association, is that they take the general fund dollars that will be freed up as Medicaid expansion and use that to offset the costs associated with the local funding match, the Medicaid local funding match. Because as I explained on Friday, that there's different match obligations for those local dollars, one of them being Medicaid. The state would then be able to pay that match directly, and we would not, at the CMH level, have to make that match obligation. And it's about $420,000, roughly. I don't know if that's clear as mud, but it's complicated.
It's complicated, I understand that. Either way, though, unfortunately, and you don't have to respond to this, whether it's Medicaid, local match, our Jackson County taxpayers are still the ones that are going to be footing the bill. So, thank you.
All right.
Commissioners, any other comments, questions? Thank you, Mary Beth.
All right, thank you.
Next, we have the Health Department report.
Good morning. I'm Shelley Bollinger, reporting for the Health Department. I know in your packets you received the information regarding the West Nile virus. And just to let you know that we have a wild turkey that has been found to be positive, in Gratiot County. So we know that West Nile virus is here. Individuals can report dead birds. If they find dead birds, it's typically crows, ravens, blue jays. They can report it to I have the phone number for the dead bird hotline, which is a 517-336-5030. There's also a website under michigan.gov. We aren't testing the birds anymore. It's rather costly process, but we know that the virus is here. So really it's just noticing that there's an increase in death of birds that would let us know that it's highly suspect in certain regions. So you can report that. The big message here is just to use prevention. Summertime is here. Mosquitoes thrive in hot, dry climates. They breed in stagnant water, and so we want people to make sure that they have good screens in their windows and doors, that if they have pooled water around their homes, to please dump that so that they aren't able to breed, and to use their mosquito repellent. DEET, D-E-E-T is one brand that works very well. Also, on the good news, our 2014 state budget has included a $2 million increase to essential local public health services. So those are our mandated services. While that isn't a whole lot when you spread that out amongst 45 counties, the last 2 years we've seen a $2.7 million cut. So we feel like things are moving in a more positive direction there. And then the last piece I wanted to mention was that we also are seeing a $4 million cut to MDCH's health and wellness programs. And that would include such things as, if you all remember, Governor Snyder's 4x4 wellness plan, a lot of cardiovascular disease reduction programs. For us, it also will be a cut to our tobacco reduction dollars. We received last year $40,000, so we could be looking at a $6,000 to $7,000 cut to that program. And I guess just one last thing I'd like to mention is you may have seen in the newspaper on MLive that we've been working, Michelle White has been working very closely with Lisa from MLive, who's been doing wonderful stories for us with the teen pregnancy prevention. And we just recently renewed our dollars from United Way, roughly $27,000 for the strategic plan of our pregnancy prevention programming. So that's all I have, if you have any questions.
Commissioners, any comments, questions for our presenter? Commissioner Rice?
Hi.
Hi.
You'd mentioned the potential health department cuts and possibly the programs that would be affected with funding being taken away. Is there any measurable stats that you have that for over the years there's been multi-millions of dollars that have been thrown into these preventative measures, if you will, throughout the country, this state? As far as Jackson County is concerned, do you have any stats that would say that these programs have been effective, or at least, or to what degree they've actually been effective?
Typically, it's hard to show prevention works. It's kind of like restaurant inspections even, until we find that somebody's sick. Then you can show that if we didn't have these regulatory programs that this has really not made a difference. But so really it's the absence of disease or disability and things that show that things are working. Cardiovascular disease is a lot of where these dollars in cancer prevention is where they're looking at cuts along with the tobacco. I guess it's hard for me to say because it's still really new, a lot of the programming that we're doing in cardiovascular. I mean, until we see a reduction in heart disease and cancers and obesity and some of those related things like type 2 diabetes for the long haul, it's probably going to take a little more time. I can show that teen pregnancy prevention dollars have been working for Jackson County because we've seen a huge reduction over the years. So if you could make sort of an analogy that way, I suppose we can show that prevention works. So.
This is a throw-in. I saw in there that in regards to these viruses, there's a vaccine for horses?
There is.
Not people?
Not people.
Okay, we know
Right.
the priority then. Thank you.
Right. Unfortunately. Soon to be, I'm sure.
Administrator Overton?
Can one get West Nile virus by eating a contaminated animal?
No. It is blood contamination.
Thank you. Anyone else? All right, thank you, Shelley.
Thanks.
Up next, we have Department of Human Services, the quarterly report. Is there anyone here?
I don't think it's.
All right, I see that the DHS quarterly report has been submitted and is in your board docs packet. Up next for a presentation, Medical Care Facility is offering their quarterly report.
Hello everyone, I'm Sandy Place. I'm the administrator at Jackson County Medical Care. And I have my quarterly report for you today. I divide it up into 5 pillars, the first of which is finance. We had routine review of census, staffing to census, overtime, financial statements, bank statements, resident trust funds, and all of those were completed timely. Our AR days out remain very strong at 41, and to give you an idea, other medical care facilities in our district run around 80, so we're doing way better. JCMCF is profitable despite case mix being slightly slower or lower in our Medicare versus Medicaid. We had our nurse consultant, Vicki Berlew, come in. She met with our MDS team to review the level of care determination which is required by Medicaid to make sure that all of our processes and procedures were in line with the regulations, and they are. Under the Affordable Care Act, we're required to have a corporate compliance committee. They were not mandatory before this year, and in March they became mandatory. We've had ours consistently right along, and it's very productive, so we have met the regulation there. I met with the finance team to review outstanding accounts and all of our financial processes, and I do that monthly. Our annual audit was completed for Medicare and Medicaid cost reports. Our cost reports were submitted with corrected labor allocations to aid in improving our Medicaid rate. For quite a few years, they had been submitted with us caring for the portion of respite and Joey's, which we had not cared for years. So we amended that cost report, the previous cost reports, to reflect that, and then submitted it correctly this year. If you have any questions about our financial reports, which I know you receive monthly, I have Mary Ann Connor here with us who has done those, so if you have any questions for her, she'd be happy to answer them. Okay. Under people, myself and my directors rounded frequently, checking on staff and on elder needs. We hosted perfect attendance celebrations and employee anniversary celebrations. We had 2 longtime employees retire in the nursing department. Met with our psychologist that provides services for JCMCF to improve our behavioral offerings. I did play harp for our elders. They kind of twisted my arm, and I did that for St. Patrick's Day and for Nursing Home Week, Blessing of the Hands. I interviewed our assistant administrator candidate, which we have chosen. We had a team of interviewees, including some residents and staff of both directors and managers, and frontline staff interviewed this candidate. It was really a productive interview process, and we feel like we've chosen a good candidate. We had all of our routine director and manager meetings. Met with the wellness team to strategize our nursing home week activities, and we had a walking event to support the health of our staff. We hosted departmental appreciation lunches for both social work and maintenance. It was their yearly time for appreciation, their free lunch. Met with union nurses on several occasions to brainstorm different ideas that they had brought forward to me and to improve union and management relations. And we continue with MNA negotiations. We have not reached settlement, but it's a non-financial component of the contract. Under service, we communicated with families and elders and staff through our various newsletters and communiques. I attended the MCMCFC legislature. Yes. Sure. Yes, we have offered her.
Microphone?
That's on our plans. She will be here, yes. No problem. I attended the MCMCFC Legislative Conference back in March and presented on the Quality Committee reports for that group at the board meeting. I represented JCMCF in an International Diversity Awareness webinar that I was able to do right from my desk, and to talk about how diversity and diverse workforces really help to promote person-directed caregiving. I attended and presented at the Spring Leadership Conference of the Healthcare Association of Michigan on ethics committees and how to develop them, and how ethics committees are critical to person-directed care. And presented at the 15th Annual Best Practices Convention in Roscommon, Michigan, to a variety of providers and ombudsmen for the mid-state area and northern state areas on consistent assignment, because Jackson County has led the way in that as well. Under quality, I met with the policy and procedure team for routine policy changes and policy changes that were directed by various surveys. I interviewed all incident and accident reports for the quarter. I attended the Behavioral Health Summit at Lifespan, which I've started to do routinely. I attended resident council. Our monthly quality improvement committee meetings were facilitated, and I provided oversight and guidance during our recent FRI survey and annual surveys. We did receive our report back on our annual survey, and it is the best survey that we have ever had. We only had 7 citations, and all were low level. That's half of what our citations were last year. Also, the Building Authority toured on their annual building review and found the building to be in excellent condition. Under growth, working with nursing to determine our electronic medical record software, which is required of us starting next year. And we continue to evaluate our strategic plan and our facility goals routinely. And that concludes my report.
Thank you, Ms. Place. Commissioners, comments, questions?
Yes, just
Yes, Commissioner Duckham?
Yeah, I'm quite impressed with the program you have set up and how you're so involved with everything, and looks to me like you have the medical care facility rolling right along.
Thank you.
Thank you for your efforts.
Thank you so much.
Commissioner Placzek?
Yes, in the software, do you know the names of some of the software that you're looking at right now?
The one that is leading the way right now is Point Click Care. It's used in most other medical care facilities. We did look at a Cerner program, but there's only one program in the state, one home in the state, and we didn't feel comfortable with the level of service that we could get from them. So right now they're coming in a far second.
All right, thank you. Any other comments or concerns for this place? Thank you for that information.
Thank you very much.
I will be going backwards just for a moment to letter F, Department of Human Services Quarterly Report. Welcome. We did acknowledge that your report was included, and we're pleased to have you here.
I apologize for being late.
Apology accepted.
All right. As it says in my report, I'll try not to read from that, but we've been waiting the budget outcome. Some of that has to do with waiting to see what contracts we'll have for the coming year and what cuts we may have. It's been going back and forth, so we're getting closer and closer to a finalization. I think maybe within the next couple to 3 weeks we may know what our budget looks like for next fall. We had a little celebratory meeting the other day at our office when we were actually fully staffed for the first time in 2 years, but that lasted about 3 or 4 days. And we're trying to fill positions again at this point in time. So we're doing interviews again. We did some last week and this week trying to fill our vacancies that you've seen in the report. We did have a worker, CPS worker come down from Roscommon County. That's really helpful to us. The process of getting a new children's services worker is a lengthy one. By the time we do the interview process and we get them on board and then we get them enrolled in training, they have a 9-week training program. So it's usually about 3 or 4 months before they're of any use to us to be able to actually take a case and work that case. So it's a long and lengthy process. So, but we were close. We got full for a moment. We're working at redesigning our office. One of the goals in our redesign is that our children's services staff will be mobilized. We're already working on that, and some of the staff have actually become mobile. We need to actually do some redesign where we tear down the cubicles and we put up what we call hoteling stations. They're just workstations where workers come in and stick their laptop in, they sign it out for the day, and they can work in the office and go out, but they don't actually have their own cubicle. One of the other ones is that we're going to add 10 additional kiosk computers in our lobby on the 2nd floor so that all of our applications we're hoping will be online as opposed to paper, because we're going to be going paperless here hopefully in August. If that happens, we really don't want the paper applications because that means we have to tear them apart, cut them down, and scan them all into the system. So it's much better if we actually put them online. So we will have, yes?
Will you be going back and imaging?
We will not be going back and imaging old old paperwork. We're going to have a half and half, and eventually it'll then be an all paperless system. So,
How long do you anticipate?
well, it really depends. We have some people who have had open cases for quite some time, and again, this is only in the payments area, not in children's services, and they've had cases open for quite some time. So, if they actually hit the limit of their case closes, then we probably won't be going paperless. But if we actually do that at this point in time and actually start scanning in now, they will probably become obsolete. I would say probably in 3 to 4 years. It probably was about as long as it would take. But the new cases that come in will be paperless right from the get-go. So it looks like in August we're going to be going. Is what our scheduled rollout is for paperless.
So the longest you probably be would be...
No, it isn't the same. That would be for a children's services case, but for a case in which we have payments, they're only eligible for cash assistance for 4 years. So that case would probably become closed in a shorter period of time. About 4 to 5 years would be my guess. Let's see. We've been getting ready to go with the online system by visiting Calhoun County. They've already been up and running with theirs for a while, and it looks like it works pretty well. It's a pretty good model, so that's what we're looking at doing. We're also been working real hard on trying to make sure that we reach our goal of 21 new non-relative homes to be licensed for foster care. That's part of our modified settlement agreement. We, at this point in time, have 16. It looks like it'll be real close for us to hit 21, and that's part of a statewide goal of 1,450 homes that need to be licensed according to the modified settlement agreement. So it's going to be a tight squeeze for us, but it looks like we might get right around 20 or 21 at this point in time, and then we have to hit 28 by September. Yes.
And the consequences of not meeting that goal?
Means we don't meet the modified settlement agreement. If we don't do that statewide, that means that they could impose fines if they chose to do that. We have been looking at, we've been working with our county child care fund, and we've had some audits recently in that area. We went to a training up in Lansing, and they're looking at going back to fall of 2011 to try to collect data as far as expenditures and outcomes for county child care funds. And what they're looking for is to say, where did the county child care funds go, what were they spent on, and what were the outcomes of those. That's a difficult proposition to go backwards to 2011 and gather that data, as opposed to letting us know up front what they want to gather. So that's been a struggle for us back and forth, asking them to give us a little bit more time. It isn't just us, it would be the court that we'd have to gather data from and other areas. So, but they called me last week. There's a federal audit of the County Child Care Fund, and they're wanting to know what our processes are, how we process payments, and what type of payments we make from the County Child Care Fund. So that started last week. We're still in, just an update with the Child Advocacy Center. We're looking for a new director. We do have an interviewer on staff at this point in time, and we're looking for a part-time director for the Child Advocacy Center. We had some interviews. We had a prospective candidate. She actually had been a director of the CAC in Calhoun County, but she declined after the interview process. One of the last things that I would like to talk about is that we're going to be holding our first annual Stuff the Bus campaign, and that is to collect backpacks and supplies for our foster care kids that go into school this fall. And I'm going to let our community resource coordinator, Jessica Deering, talk a little bit about that. She's the one that's actually been arranging all of the aspects of the Stuff the Bus campaign, and she's got all the information, and I think she can answer those questions for you.
Hi there. We are starting, again, he said our first annual. It's going to begin August 9th and run through August 23rd. At this point, we are stuffing the bus August 9th and 10th, and the bus will be at the Westwood Mall parking lot. The Jackson County ISD has volunteered the use of their bus for that two-day event. And last week, Jerome and I met with Channel 10 and their general manager and Dave Ackerley, and they're going to partner with us on this. So they'll be there doing live coverage for that first two-day kickoff. And then for 2 weeks to follow, Flagstar Banks and Evolve Fit Club in Jackson are going to have drop-off locations where folks can drop off supplies. So we have good momentum at this point. We do have a donation from Westwood Mall, and they've asked Walmart to match that donation. of 200 backpacks, and they'll donate $750 in school supplies to start it off. So we're excited, and you can come out.
Jessica, thank you so much. I know you have put a great deal of time and effort into this program, and you are to be commended. And the entire community, the way we are collaborating, that is, it's great that people are volunteering and stepping up, and we would encourage all of the energies and agencies that you work with and organizations that you are involved with to get involved with this to benefit our foster children and prepare them for the next year of school.
We're really excited.
They're cringing right now. They're saying, I just finished school. And now they're already talking about
We're not talking to them about it yet.
Not only the students, but the teachers, yes.
So yes, right now we're able, with the donations we received so far and the support, we're able to at least reach our 250 foster youth that we have in our county. So we hope to expand it and work with JPS to make sure those backpacks are distributed throughout the city as well.
Excellent. Well, thank you, Jessica.
Thanks.
I didn't know if you had any other questions for me before we wrap up.
In regards to the Stuff the Bus campaign, which, well, maybe Jerome might want to answer this, Jessica, either one.
All right, we'll try.
Obviously, like Commissioner Alexander said, that's obviously an awesome thing that's going on. One of the things I noticed, though, is that you're going to utilize the faith-based community as well in that program. But I also noticed that you're not able to license or engage faith-based communities as far as your homes are concerned. What reason have you been given for that?
Sure. Go ahead.
I've actually been the one doing some of the outreach with our faith-based partners, and I will say that Cascades Baptist Church is one of our backpack supporters, and they have actually now agreed to have us come and visit their church and talk. They have quite a bit of foster and adoptive parents within their congregation, so they've agreed to let us come in. What we're finding when I'm contacting and talking to the pastors of the churches is most of the pastors are on board with us coming, but once they go to the elders of the church or to their board to discuss it further, it's not something they want to bring into the church, and the rationale, it varies, but most of the time it's, we don't let other groups come in to do this, so we have to draw the line. So they've asked, but could you send their brochures so we can make them available? So we have sent brochures and flyers out. One thing, I don't know, McDonald's in Jackson, I did reach out to them, and it looks like in September, there's 7 McDonald's locations in Jackson. They're going to let us do tray liners with our local contact number, advertising the need for foster parents. So I think that's a good effort that is pretty visible to parents and kids that are out there. So, but that's the rationale that I've been receiving from our faith-based.
All right, thanks.
Mm-hmm. What other questions, comments might you have for the DHS? All right, Jerome, and we'll just be anxiously waiting in 2-3 weeks to know more about this budget. Thank you. Up next on our agenda, moving down to Veterans Affairs. Mr. Wellahan, your biannual report, please.
Good morning. I'm David Wellahan, for those that don't know me, and I really appreciate you not forgetting that I was sitting here today. Twice. Yeah, that's right. Who's counting? For over 140 years at the VA and its predecessor institutions have had one goal in mind, and that's to care for those that have borne the battle. Their only mission is to accomplish this by operating the largest integrated healthcare system in the United States. They have the largest national cemetery program. They have the 8th largest life insurance program that covers active duty and veterans life insurance policies, and actually they have over $1 trillion out in life insurance policies. And an education assistance program, a home mortgage enterprise, which guarantees over 1.4 million homes right now. And incidentally, you folks would be happy to know that veterans that have their homes guaranteed through the VA program have the lowest foreclosure rate in the United States going right now, too. So let's get as many veterans in a home loan as we can. For almost 3 years, the VA has followed 3 fundamental guiding principles to be people-centric, results-driven, and forward-looking. The The VA is focused on 4 strategic goals to shape their efforts and to transform the VA into a 21st century organization. And I thought it'd be kind of interesting, since we all have our own strategic goals set up here in the county, hopefully each department does, and I know as a county we do, that you'd like to hear what the 4 bases are for the VA program. Number 1 is to improve the quality and accessibility of health care benefits and memorial services while optimizing value. Increase veteran client satisfaction with health, education, training, counseling, financial and burial benefits and services. Raise readiness to provide services and protect people and assets continuously and in time of crisis. And number 4 is to improve internal customer satisfaction with management systems and support services to make VA an employer of choice by investing in human capital. The 3 main objectives or goals that they've identified to have completed, I guess would be the right term, by 2015 would be to eliminate homelessness for the veterans, which is huge when you consider 20% of the veteran or the homeless population are veterans. Eliminate the disability claims backlog. Right now in the Detroit Regional Office alone, there's over 33,000 claims that are pending. 62% of them are over 125 days, which officially puts them into backlog status. When we write a claim today, we're telling folks it's going to be somewhere between 14 and 18 months when it should be done. Federal law says it has to be done in 180 days. So kind of gives you a little idea how far off whack they are right now. And then we want to improve the veteran access to benefits and services, and that goes along with that backlog stuff. The information that I forwarded to you on board docs kind of gives you an idea where we stand right now in the county with dollars returned. We had $24,677,000 come back in compensation and pension payments. Those are direct payments to veterans and dependents that qualify, monthly payments that come back into their bank accounts or whatever. I wish I could redirect at least half of that to the county itself so that we could all, fund our offices or whatever, which would be nice. $49,308,000 is the total expenditure for 2012 that the VA spent on the veterans in Jackson County. That includes not only the compensation and pension, but vocational rehabilitation, education benefits, insurance indemnities, health care, everything, the full package. That's how many total dollars were spent. We had no construction costs in 2012, so that's not offset. But if you look at the graph I sent you, we went backwards. And it bugged me to no end, because I was expecting from the numbers and the way we'd been growing over the years that we'd go over 30 million. And it confounded me just a little bit, because I couldn't understand why, knowing how active we've been and how many good positive claims we've written. So I contacted the Analysis and Statistics Department from the VA and asked them, did you change your formula or what's going on? And their answer back to me was, sort of, which was, anyway, he did continue to say that what they did was, before they were using a program that was called Data Systems something, DAAASD, I think it was. What that was it was an estimate, and his last sentence to me was apparently they estimated a little high. What they're getting their information now from usaspending.gov, which is an actual reading of the budgetary spending that they for each of these items that they looked at in the VA system. So these are true numbers, and it's the first time in the 9 years that I've been here that they've apparently actually used true numbers. But if you look at it, even though we went backwards a little bit, we're still above where we were at in 2010. So I feel pretty well about that, and knowing that the numbers are pretty consistent. Is there anything in any of that I sent to you want me to try and explain any further than what you've read? We're all pretty good on that? Okay. So, all this recovery is a product of cooperation with a team of experts. We have the Marine Corps League that is in our office on Mondays, every other Monday right now. In fact, he's in the office right now working on claims while I'm over here trying to explain what it is that we do, which in some days is just easier to come and see what we do, because we're averaging about 180 clients a month right now. We we'll take anywhere from 10 to 22 appointments in a day between the three of us. When I say three of us, I'm talking about the service officer, Tim Garino today with the Marine Corps League. Every Tuesday we have a representative from the American Legion, and then every other Wednesday right now we have a representative from the Military Order of the Purple Heart. So I count them as one when I say the three of us. Sherry is the other one. She does all of our bereavement claims for all the marker orders for a deceased veteran, or the funding that's available to a veteran for burial benefits. By the state of Michigan mandates every county in Jackson to offer $300 to any wartime service veteran with an honorable discharge that has less than $40,000 in assets at the time of death. We can offer them $300 to help cover the cost of some of their burial or funeral costs. But if a veteran is receiving a benefit, one of these disability compensation or pension programs through the VA, then we can apply for up to $1,400 in funeral and burial costs, or if the veteran passes away because of a disability that he has a service connection for, or if he's 100% disabled for more than 10 years, then we can get $2,000 in burial costs from the VA. Plus then we have a program for the spouse, which is called DIC, which is right now, if a veteran passes away because of a service-connected disability, we're able to provide this surviving spouse $1,215 a month tax-free for disability compensation. It's called dependent indemnity compensation. Plus we can get her a program called CHAMP VA, which is a health insurance program that's identical to the TRICARE program that dependents of the military uses, only it's run by the VA instead of Department of Defense. But this whole package of people that we have over there, between the three of us that are in our office daily, we have the homeless representative from the VA. Her name is Kate Hardwick. She's in our office. She's in Jackson County every day. This is her assignment area. She does a half a day in Hillsdale. Smaller county, fewer veterans. But she's in our office once a week at least. She's in the CBOC most days, or in the library, or at McDonald's, or wherever she can meet a veteran that needs to get somewhere to meet her. We have a counselor coming twice a month right now from the Vet Center in Dearborn that counsels combat veterans. Something new since the last time I've been in here in front of this panel is we now have a military sexual trauma counselor coming in once a month right now. She actually is seeing 4 females and 1 male veteran right now. But as we advance her needs, she's guaranteed us that she's going to be able to come more than just the once a month. She drives all the way out of the Detroit Vet Center right now to come down here and work with us. So, and every week we're getting more and more of these claims for military sexual trauma. So it's pretty important that we have somebody like this. In fact, right now, and I don't understand the VA's thinking, she's the only certified military sexual trauma counselor in the vet centers in Michigan. Now there are in the psychiatric department at the hospitals, but they're separate from there. So we have a big group of people that are all responsible for this. So, you know, I'm just the conductor. I work here every day. I play with these numbers. I support these service officers. I do a good number of the claims myself. I am accredited by the American Legion, so you folks know, and now by the Marine Corps League, which is new since the last time I've been here. But we train 3 times a year, you know, to keep on top. Our training is conducted by the National Veterans Legal Services Program, which is a legal program out of Washington, D.C. So.
Thank you for all that information. Commissioners, what questions, comments? Commissioner Shotwell?
That's what the count was according to USAspending.gov was for Jackson County. If you notice, that's an increase though. Even though our dollar returned decreased, our veteran count increased because they said we had 12,009 veterans in 2011. It's all veterans. Now, it does, yes, all war periods, all service, all branches of the service. However, it doesn't count the National Guard people, that, like the 130 that just came back last week, because they're still active with the National Guard. So they don't count as veterans for this purpose. Not to get counted, I think basically that's all based off from once they discharge from military service. And so that's one of the hard parts that we have. We have 4 National Guard units and 1 Army Reserve unit in this town. The problem that we have is the National Guard is a state organization. So unless they're actually activated like this 130 folks that just came back last week, there's not a thing I can do for them for benefits. because the VA doesn't recognize the National Guard or the Army Reserve as a branch of the military service. Their requirement or eligibility law says active duty service, and they're not considered active duty unless Title IX steps in, and then, or Title 10, I'm sorry, and then they're activated federally, like what they just came back from Afghanistan.
So then those people would be
Today, yeah, when they came back from that active duty period, even though they're still active with the Guard, we can write claims for them and get them involved with the VA healthcare and the VA. And right now, anybody that comes back from a combat zone automatically gets 5 years of health care through the VA at no cost. And whether they have a job that would preclude them, because the VA has thresholds for income and some requirements to qualify for the health care. But these folks would all qualify automatically.
nationally some honorably discharged veterans. Do you have a relationship with those firms here in Jackson, or is that all conducted through their national headquarters?
That's actually a federal mandate for all federal jobs, veterans, and then veterans with a disability. There's a standard form 15 that needs to be figured out so that they can get their points. Most of that's handled through the veterans representative over at Michigan Works. His name is Scott Hamill. He's works for the Department of Labor here in Michigan, but we're on the phone at least 3 or 4 times a week, or emailing and sending folks back and forth all the time. So we work hand in hand with that office. But most of that would be done through his office rather than ours. We're trying to concentrate. I mean, I get 5 emails a week, listing anywhere from 3 to 10 job postings through a headhunter organization. I always have those posted for the folks that need to look for jobs, and then we support them as much as we can. But our priority in our office is the right to VA claims. So I let him do his job, he lets me do my job, but we work back and forth all the time on that.
Now, to qualify,
These programs are federal, so it doesn't matter where you enlisted or where you discharged, as long as you had active duty service. Now, the old rules was 180 days of active duty with 1 day during a period of war for certain programs. Now, since September 9th of 1980, a person has to have had 2 years or 24 months of consecutive service in the military in order to qualify for many of the programs of the VA, including health care and including the marker, the burial marker. Always direct them to our office. I don't care where they're from, except the policy that says I can only work with veterans from Jackson County. But in fact, I have a client.
that's my question.
No, if they live outside of the county, I'll direct them where they need to go. I have everybody's phone number in the neighboring counties.
If I live here in Jackson,
If you live here in Jackson County, ours is the office. Absolutely, absolutely. But we have a client that has been reactivated that was in the Guard, and he works in a cardiac care unit for the Army right now at Rock Island down in Illinois. And anybody that comes back to Michigan, he has them call me, so find out where to go to get the help that he needs. Mr. Duckham.
thank you.
Yes, sir?
Yes, Dave, anybody you get calls, do they call you looking for jobs? Because we kind of have a veteran's preference at Modern Waste.
Quite often I'll have people call me and ask about jobs. But again, unless it's something that I have a real tight handle on, I'm going to refer them to Scott over the Veterans Rep, because the program that he works through with the Department of Labor, places like Aeroquip, for an example, or Eaton as it's called now, he'll get a 36 to 48-hour heads up on those types of businesses to get veterans in their first shot before it's open or posted to the public. And he has the handle on that stuff. I don't hear that unless he happens to tell me about it.
You can send them our way too. Modern Waste if you want to.
Yeah,
Thank you.
certainly, thanks.
So for clarification, when you mentioned Scott, you're referring to South Central Michigan Works?
His name is Scott Hamill. His office is in South Central Michigan Works, but he actually works for the Department of Labor, State of Michigan.
Okay.
He's a DVOP, which is something that stands for he works with disabled veterans.
Okay.
Yeah.
All right, thank you.
Yes, ma'am.
Any other comments, questions? All right. Thank you.
Thanks, folks.
The May of 2013 claims have been reviewed, sent around, and signed.
Move to forward the claims.
A motion by Commissioner Rice and supported by Commissioner Leitner to pay the claims. All in favor? All opposed? In our agenda packet, under other minutes, we have the Advisory Council on Aging minutes and DHS Board meeting minutes. Our July reporting schedule will be Department on Aging, Health Department, Lifeways, Animal Shelter, and Community Action Agency. That leads us now to the final public comment. Is there any public comment? Public comment is now closed. Moving on to committee member comments. Seeing none, I move to adjourn to the call of the chair.